something has likely been bothering you for a while, whether that's pigmentation or lines between the brows or crow's feet or sagging to the skin redness, and all of those things. If that's kind of bothering you and it's inhibiting your confidence and your ability to show up in your personal and professional life, and there's options that are available, I would say that that's a healthy approach to then desire to seek rejuvenation to address those things.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. Rachel Varga, who has been offering medical aesthetic rejuvenation in the specialty of oculoplastics since 2011, and is known for providing a natural and healthy-looking transformation. She has performed over 20,000 rejuvenation procedures and is also a trainer for other practitioners on rejuvenation procedures, including medical-grade skincare, laser skin rejuvenation, injectables, including neuromodulators and dermal fillers, and slowing aging in general. She has published multiple research articles on rejuvenation protocols for the eyelids, jawline, and overall skin health transformation. She's also one of the first to blend Western approaches to skincare and rejuvenation, functional insight, and biohacking optimization strategies. So Rachel, welcome. Glad to have you on the show.
Thanks for having me, Daniel. It's great to be here.
Yeah, so let's dive right into it. How did you first get interested in medicine, in aesthetics, and biohacking?
After I graduated nursing school, I didn't quite feel done with learning, and I actually considered becoming a physician myself and did my medical school prerequisites, wrote the MCAT, and in preparation of, potentially becoming a physician myself, I partnered with an incredible oculoplastic surgeon to learn the runnings of a oculoplastic surgery clinic, and also I headed up the medical aesthetics. And I actually really fell in love with it and really enjoyed working with healthy patients and just helping them look and feel their best. And then I started to observe that those who got the most out of their rejuvenation were doing specific things in their lifestyle to reduce oxidative stress. And then that led me down another path to actually publish research on that very topic and how we can get the most out of our rejuvenation through also lifestyle enhancements as well.
Got it. Now, in the introduction, there's a lot of different things that you do. So can you talk about some of the most popular, treatments that you provide? And then why do you think that they're so popular?
I would say the most popular treatments that I provide are going to be in the non-surgical realm. So whether that's optimizing skincare or injectables with neuromodulators and dermal fillers, or laser, and sometimes eyelid surgery, given my background in oculoplastics since 2011. Those are the most popular rejuvenation options that people seek me out for. And that demand isn't going anywhere. However, I'm also just really excited about where the field is going in the space of longevity too.
Okay. So, and that's, I think, a great segue into this next question. What are the new or emerging treatments that you're particularly excited about?
Obviously, exosomes, stem cells, and peptides. And I was actually invited to speak at a conference a number of years ago. And I was in a room of about 30 of North America's top stem cell experts and physicians. And I felt like I was in a room of when people first started talking about neurotoxins for fine lines and wrinkles. And it was just really exciting to me to see these innovators, you could call them cowboys at this time, because they're really leading the way with the products and also the protocols of how they're applied. So I'm really excited to see where that is actually headed. And I typically see with any new product on the market, we've seen this with lasers, we've seen this with injectables, typically takes about 6 to 7 years for the product to be dialed in, but also how it's applied and the protocols. I'm really excited to see where this is going. And we're already starting to see exosomes being applied after in-clinic microneedling and in-clinic laser skin resurfacing. So I'm excited to see where the future brings that.
Yeah, it's interesting because when it comes to regenerative medicine, before I was kind of seeing more practices using it for joint pain, knee pain, back pain, neck pain. And now more recently, within the last couple of years, I'm seeing it more brought into the aesthetic side. of medicine. So in your opinion, kind of what do you think was it that kind of caused regenerative medicine to make that jump from more of like your aches and pains over to the aesthetic side?
I would say the consumer demand, right? Aesthetic medicine treats individuals who are typically 35 to 90. Now, what's going on during that time? Perimenopause, menopause, postmenopause, the overall aging process. And the one thing that's also really interesting when we look at data, actually federal data, is that autoimmune diseases are on the rise. And what's the number one contraindication, or one of the things that leads to higher rates of adverse events? Those who have autoimmune conditions. So in order for more people to potentially have better outcomes, this is something that also needs to be addressed. And in my research on autoimmune conditions, it's often tied to some type of nutrient deficiency left unchecked that causes downstream issues. So I would say it's a natural blend of the two based on the population that aesthetic practitioners serve.
Got it. Now, I think there's a differentiation that that exists in here between regenerative medicine and functional medicine. So I think in the application of it, there could be some blending between needing both of them to really optimize your health. But for people who don't know the difference, what would you say is the biggest difference between regenerative medicine versus functional medicine?
Well, my specialty is not in functional medicine, and I am excited to get certification in that when the time is right, because I'm always learning myself as well. And when you think you know everything, you know nothing. And we're always learning, especially in this field of aesthetic medicine in and of itself. And now the different branches of regenerative and functional. The way I look at regenerative is how we can regenerate the body, which I think is more closely linked to looking at biomarkers such as blood sugars and hormones and the overall oxidative stress status of the body. And I would consider that functional is looking more at the function of the body, how we can optimize the function. And when I think of regenerative medicine, I think of individuals that say have a knee injury or a shoulder injury, and they're looking at options like PRP or stem cells for that. And functional is looking at more like hormones and actually slowing the aging process. In my mind, that's how I view those two. But really, I'd say they're very intricately connected.
Okay. And when it comes to biohacking, we were talking earlier before we started the recording here about biohacking, going to an event on biohacking. Now, I think some people may have heard the term, but I think a lot more people don't really understand what biohacking is. So could you describe a little bit more about what is biohacking?
Yes, actually, the founder of that word, biohacking, the creator of that word, he's actually a good friend of mine. His name is Dave Asprey. He's known as the father of biohacking. The definition of biohacking is the art and science of modulating your environment to support your biology. And in my research paper that I recently published on oxidative stress, I looked at where in our environment are we accessing and getting exposed to environmental toxins. And that's in our air, water, lighting, so blue light, for example, electromagnetic radiation and electric fields, and food quality, as well as different pathogens like yeast, fungi, mold, heavy metal, parasites. So biohacking, what's really cool about this is that it's actually empowering to the individual to then use different technologies like sleep trackers, continual glucose monitors, and also lab work that's a little bit more extensive than typically what you'll get through your primary care physician, to look at where you're at. And also what's really neat about the biohacking space, especially in the field of actually looking at biomarkers, is that there's these algorithms with these companies that are processing lab results, and based on results, they have algorithms to actually then empower the patient of what to do to actually adjust those biomarkers for the better. So I think that this whole concept of empowerment of the individual at home, actually using algorithmic based recommendations, just is really streamlining, and I think could really help more of the population get to the root causes of what's causing things like skin redness, dry skin, accelerated aging, hair loss, loss of energy, hormone imbalance, the list goes on. So I think it's a perfect segue. And I also can't help but notice that in the patients that I see in the clinic, those who are actually incorporating different biohacking strategies like air and water purifiers, blue light blocking glasses to support circadian rhythm and sleep, as well as even doing things to mitigate EMFs in their environment through clothing or different technologies to create more coherence of sine waves, because we have electrical wiring throughout our homes and routers, which causes incoherence of energy, which impacts our cells. This is now well researched. There's so much that we can do now. And those individuals that do that, I find that they require less rejuvenation. But what's most interesting to have noticed over the years is they have a faster recovery. Say, for example, after surgery or after laser skin resurfacing. I've actually seen it where their recovery, which should be about 5 days of redness, say after a fractionated laser session, their recovery is more like 2 to 3 days of redness and swelling.
Wow, that's incredible. I mean, something that I think people just haven't heard about, but there's so much power behind it. And it's interesting, like I've been interviewing a lot of people in the aesthetic space, and more of them are getting into regenerative medicine. I think it's interesting though, because when you talk to the average person about aesthetics, about beauty, like how do you improve your beauty? How do you improve your aesthetics? I think more often than not, they would be thinking, oh, I think of like a cream or something I put on my face or something that I inject or some type of surgical procedure. But we're talking about regenerative medicine, biohacking. It's almost like you're fixing your body, and when your body is healthy and good, then your beauty comes out. Is that kind of
Absolutely.
how you're looking at it?
100%. And I mean, my own personal story, I was in not one, but 2 car crashes. And I had been doing a number of biohacking strategies to reduce oxidative stress leading up to it. And thank goodness I did, because I experienced pretty significant whiplash. And for me not to feel in pain or have headaches or have my sleep disturbed, doing these different things really helped me feel better. And then I actually started to notice the differences in my skin too. So I think what we're seeing are practitioners that, of course, have access to all of the medical aesthetic services, and then they're integrating these other aspects and they're seeing the results for themselves. And when there's research to back up, exactly what these different regenerative and biohacking strategies are doing for actually reducing, say, exposure to mold and VOCs, which have a direct impact on the skin. Particulates in the air, when they sit on the skin, they actually result in keratinocyte stem cell apoptosis, so early cell death of the keratinocyte stem cells, and we don't want that. So there's a really interesting element that myself as a researcher, when I see these linkages, I find it so interesting. And this is also why washing your face is so important, and your skincare, to get the debris off the skin. So we're just learning more and more. And again, just with me having an observer perspective and being a researcher and actually looking at nationwide statistics on autoimmune conditions, I would be doing myself and also the community that I serve a disservice by not staying on top of this myself to give the highest standard of care possible.
Okay. Now, when it comes to these different treatments, we talked about regenerative medicine, aesthetics, non-surgical biohacking. I'm sure there's a lot of misconceptions that people have about, okay, what are these treatments? What do they do? How can they help me? So in your experience, what have you seen that are some of those common misconceptions that people have about the treatments that you provide?
Absolutely. Well, most people are dealing with something called sagging skin, right? Gravity is what really creates a descent of the facial features over time. We also lose bone, we also lose fat, and of course, the loss of collagen and elastin, especially during hormonal shifts like perimenopause, menopause, and postmenopause. So when it comes to misconceptions, I would say that this is related to the concept of skin laxity and skin tightening. The consumer is going to be driven by something that they can do easily, maybe one thing. And based on our culture, it's a click and get culture. Order this one skincare cream, it's going to solve all these problems. Or do a package of 6 of this type of rejuvenation, it's going to solve all your problems. But really, the misconception lies with actually what's causing the facial aging to begin with, which is gravity and descent of tissue, as well as loss of bone and fat and collagen and elastin from hormones. And oftentimes, the misconception is, okay, do a package of 6 of this laser rejuvenation session and it's going to address that. When really it's actually going to be through a multifaceted approach to skin and rejuvenation to address the various things, like thickening up the skin for more collagen and elastin, reorienting the facial muscles to reduce the pull down and descent of the brows, fullness of the DAO, as well the jowls, and also restoring lost volume. So I would say that's the misconception, is that people think it's going to be one thing that fixes things like sagging skin, when really it's going to be a combination.
I think that's a great point you bring up, is that when people think about, I want to get this thing fixed either on their face or their body, they think it's just one thing. But in reality, it's going to be a summation of different things that you have to all get right to make it work for that one place. So now I want to talk a little bit more about yourself, your practice. What would you say really differentiates you from others in the industry, or your practice from others in the industry?
So this is speaking to my unique value proposition. And for fellow medical aesthetics practitioners, they often don't know what this is, but it's actually going to come from your patients telling you why they're coming to see you. And one of the things that I kept hearing over and over again, which then I finally listened to, was I take my time with each of my patients and take the time to listen to what their needs are, what's their lifestyle like, and what type of rejuvenation options are going to help them achieve their skin goals, and then give them that plan. Not just, okay, do a package of 6 of this, package of 6 of this, package of 6 of this. We're seeing that isn't always the best approach, but it's really customizing the plan for each individual. So that is actually what really helped set me apart. The other thing was actually just this desire to educate, and in particular tips for what to do before rejuvenation and what to do after. That's actually where I started to create content online many years ago to provide that education. So I would say it's taking the time so that patients feel heard and that their needs are being addressed, and then giving them that ongoing support through educational content online. And always being there, right? It's our job as aesthetic practitioners to be the guiding light for our patients during their skin rejuvenation journey, not just for them to feel rushed in and out so that the next patient can be seen.
Got it. Now, when it comes to medicine, I think people have this mentality of, oh, there's a process, there's a step-by-step, there's a protocol that goes into it. But what would you say what role does creativity play in how you approach patient care?
Well, I'm happy you asked this question, because I've actually published 2 papers, one on eye rejuvenation algorithms and the second one on jawline rejuvenation algorithms. So when we're assessing things like through photography, we can see that what we're doing is working. And if you're not as diligent with taking photos before and after, then you don't really know or have an objective analysis of what you're doing. So what's interesting about protocols is, well, what's going to give the most predictable outcomes? And absolutely, it's going to be individual for everyone, depending on what, for example, the frontalis muscle, there's like 5 different types of orientations of the frontalis muscle to the forehead. Same with the glabellar complex. So it's not so much creativity, it's about taking this time to assess what's going on with the individual and their aging practice. Now, one of the reasons why I would say that some aesthetics practitioners are better than others is it also comes to the eye. And also it depends on where someone is culturally, where they live, and what's trendy in regards to, big lips or big cheeks or not being able to move the face. It really just depends on all of those. So creativity, half art, half science, having the eye, and the keen desire to learn ongoing, these are all going to be part of the protocol. And then, of course, you can check out my eye and jawline protocols that I've published as well.
Got it. Okay, perfect. Now, throughout your experience, I'm sure you've run some particularly challenging cases, some particularly challenging patients that have come your way. Could you maybe tell one story about one that was really tough and how you were able to get them a successful result in the end?
Absolutely. Well, vascular occlusion, right? Everyone who's doing medical aesthetics and injectables, especially fillers, this is, the one thing everybody wants to avoid. But when it did happen, I had the protocols in place and the correct support team to very quickly reverse that and deal with it. And that individual, of course, it happened on the weekend, right? They were an out-of-town patient. But because we were able to roll out the red carpet treatment to address that patient and actually her mother still continue to be long-term happy patients of mine, because they knew, because I fully explained that there's always risks. This is what to look for. So she knew what to look for, and then relate that information to me as needed. The other types of challenging cases that I've seen are with individuals who have underlying autoimmune conditions and also elevated levels of oxidative stress. So say, for example, pain. Someone's going to experience more pain if, say, they just got off a flight the day before, they didn't sleep well, they're emotionally a little bit dysregulated. That can result in pain, more pain during the procedure, which can slow things down and things like that, and not create as pleasant of an experience. But it's the autoimmune stuff that I think we're seeing more and more of that is, I think, a direct contributor to higher rates of adverse events as well.
Got it. Okay, good to know. Now, I want to switch tracks and talk about your training, because you've trained other medical professionals. So can you talk a little bit more about kind of what you do for your training, how you got into it, everything about your training?
Well, the training happened, I would say, about 7 to 8 years into my career, when I actually started to get approached by the various companies that actually make the products to do lectures and then actually hire me to do trainings. And through publishing my papers, presenting on them, and then other individuals wanting to learn my methods as well. So that's really where training came from. It actually started when I initially published papers on my rejuvenation algorithms, which substantiated that. And a lot of times when practitioners get into the field, they start training after, a year or two of being in the industry. And it really takes time and experience. I've been in the industry since 2011 to have gone through things like an occlusion, to have dealt with clients who are a little bit more stressed out than others, who have experienced what can happen if you don't listen to that voice inside and someone actually has an underlying autoimmune condition. So the training was it was a natural segue into my career, but it happened at a certain point when I felt very confident in my protocols and published papers on them, and actually started speaking myself on them, and just, people coming up to me and desiring to hire me for training, and also companies.
Got it. Now, who would be the best kind of fit for people looking for your training? Like, who are those types of people, like the best fit for your training program?
Yeah, I would say primarily new practitioners that have, for example, already done their basic neuromodulator course. They've already done their dermal filler course. And a great tip, actually, a free tip here, is to master neuromodulators first before getting into the fillers, so that you gain the dexterity and the comfort and the confidence with using needles. So I would say who is best suited to work with me is someone who's relatively new, but also I've taught many advanced injectors who have more experience than I do. Those who have a desire to learn and who are also looking to provide consistent outcomes and in a safer way. And my first paper was actually basically a paper on all the things you can do to rejuvenate the eyes before having to do tear trough filler, which is one of the highest risk areas of migration of filler, lymphatic drainage, Tyndall effect, and all of those. So I tend to attract people who are really interested in consistent outcomes and providing rejuvenation in a safer way.
Got it. Okay. Now, Rachel, we talked about this a little bit before, but where do you think the future of aesthetics and, I guess, just regenerative medicine, functional medicine, biohacking, where do you think the future of that's going?
Well, that is the future. It's the integration of medical aesthetics with being healthy. The whole aim of aesthetics medicine is to help reverse the facial aging process and the signs of aging. And you're not going to be able to fully do that with just skincare, lasers, injectables, and surgery. You do want to get to the root cause, so that, say, for example, when you are doing laser skin rejuvenation to promote more collagen and elastin, you want that oxidative stress to be lowered and also have the right nutrients on board to support happy and healthy new collagen formation from the lasers. If someone's nutrient deficient, they're not going to have as good of an outcome because their body just simply can't make the same type of high quality collagen as others. So there's a lot of really interesting things that are happening in the industry. I'm seeing this concept of beauty and biohacking really starting to take traction, especially this year. And I do have a really good track record of seeing things or the writing on the wall before it happens. And so I started to notice this trend, I would say back in 2016, 2017. And now we're really seeing it become more popular. But it also, again, the trend really comes from what the consumers are seeing. They're seeing, take this supplement, modulate your sleep, balance your hormones. There's a knowing that, of course, these are going to help to slow the aging process. So why not couple that with rejuvenation?
Got it. Thank you for sharing. Now I have one last question for you, Rachel, but before I ask it, I want to point people to your website at www.theschoolofradiance.com. Now, last question is, what do you think is the most important piece of advice you can give to someone who's kind of on the fence of getting an aesthetic procedure done, but isn't quite sure which provider to choose?
So for someone who is considering receiving rejuvenation, well, first of all, something has likely been bothering you for a while, whether that's pigmentation or lines between the brows or crow's feet or sagging to the skin redness, and all of those things. If that's kind of bothering you and it's inhibiting your confidence and your ability to show up in your personal and professional life, and there's options that are available, I would say that that's a healthy approach to then desire to seek rejuvenation to address those things. Now, when it comes to seeking a practitioner, I recommend checking them out online. Are they showing up on video? Are they an instructor? Are they a researcher? Are they very active in receiving education themselves as well? There's lots of practitioners out there that say have pretty much just relied on their initial injectable training courses and initial laser courses, but they're not really up to speed with what's happening in the industry. And this takes a specific type of individual to give up their evenings and weekends to learn and continue to advance themselves in the field of aesthetic medicine. So look for those keeners and look for those practitioners who are actually teachers themselves.
Got it. Well, there you have it, Rachel sharing her expertise. Now, Rachel, where can people contact you in your business?
Everything is over at theschoolofradiance.com. You can check out my podcast, the School of Radiance podcast, my research papers. You can book a one-on-one to talk about what training you need, and also for the, learning what your unique value proposition is and how to attract those ideal patients. I do all of that. And that's all readily available over at theschoolofradiance.com. And of course, I would love to connect with you and warmly invite you to send me an email over at info@theschoolofradiance.com.
Perfect. Well, great. Thanks for being on the show and sharing your message.
Thank you for having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.